When it comes to type 2 diabetes and metabolic dysfunction, we are chasing a wrong target, right? Insulin resistance is not the cause of type 2 diabetes, rather it is a symptom of something very fundamental, which is nitric oxide deficiency. Now our body produces nitric oxide via two pathways. First is the oral microbiome, where oral microbes actually metabolizes nitrate in various green vegetables into nitrite. This nitrite mixes with the stomach acid to produce nitric oxide. The second pathway is the endothelial pathway, where a specific enzyme ENOS actually metabolizes semi-essential amino acid L-arginine in the presence of oxygen to produce nitric oxide, right? And what happens when you consume something sweet, when you consume a carbohydrate, your oral microbes actually pre-process these carbohydrates and send a biochemical signal to pancreas to start releasing insulin. And pancreas releases the insulin, and this insulin actually binds to the insulin receptors on fat cells, liver cells, and muscle cells. And this starts the intercellular signaling cascade, right? And these cells tell a particular protein, GLUT4, to go to cell membrane, bind to glucose, clear it from the circulation, bring it back inside the cell. And this communication needs a signal. This signal is nothing but nitric oxide. So if your body is not producing nitric oxide, GLUT4 does not get this signal. It cannot bring the glucose into the cells, and you have high level of glucose in your bloodstream, and this sends another biochemical signal, and pancreas releases more insulin. But since there is no nitric oxide, this ends up in a vicious cycle, and you have hyperglycemia and type 2 diabetes, right? So you really need to fix your nitric oxide production rather than just trying to suppress your symptoms, or trying to just reduce your sugar consumption. No doubt sugar is one of the factors that could lead to functional loss of nitric oxide production, but there are multiple other factors, right? Oral dysbiosis, consumption of artificial sweeteners, consumption of very high ultra processed foods, use of fluoride in your toothpaste, consumption of mouthwash, right? And even drugs such as antacids and blood pressure lowering medications, all these disrupt your nitric oxide production, right? And even essentially seed oils as well, right? So all these disrupts or interferes with the nitric oxide production. Therefore, understand the underlying cause, which is what is causing nitric oxide deficiency, rather than just trying to remove only sugar from your diet. If you understand the real cause, sugar may not be the cause. There may be other provocative factors that may be causing nitric oxide deficiency.